Today on Rescue Vet, a King Charles Cavalier is brought in for a follow-up for mitral valve disease. Will ultrasound results reveal that her condition has taken a turn for the worse?
And when I listen to her heart with my stethoscope at home, I wonder sometimes how she can keep going on like she is.
A Koda is taken to the vet after being rescued. Will her nervous itching and hair loss be diagnosed as a highly contagious disease?
It gets into the bloodstreams, and you get systemic disease and even death from it.
4 months ago, Sarah Rager's 9-year-old King Charles Cavalier named Sophie was diagnosed with mitral valve disease. Today, she is at Bees Ferry Veterinary Hospital for a follow-up to see if the disease has progressed and if she needs to be put on any more medications.
She was just in for her annual checkup. There was nothing wrong with her, but we heard a heart murmur. And when I told her that Sophie had a heart murmur, I mean, she cried.
I've had her checked every year and she's never had a murmur. And I was really pretty bummed about that because she'd never had one before. Cavalier Spaniels have this mitral valve disease, and so I knew that it was possible that she would have it.
So we thought, oh, we better check and see if her valve is diseased.
Dr. Sanger discovered that Sophie's valve was in fact diseased, so she was put on medication to reduce her blood pressure and make life easier on her heart. Even with the use of medicine, her disease could progress to congestive heart failure. The prognosis for congestive heart failure could be 3 months to 3 years.
What happens is over time, the heart will become larger and less efficient, and the valve will further deteriorate. And then she will eventually become symptomatic, and ultimately she will go into congestive failure and probably not be able to survive all that.
So the idea is to catch the disease in its early stages, start medications to delay progression of the disease. We're going to ultrasound her heart today to see how it has changed. How fast is this disease progressing? Is this disease progressing at all?
Hello again, how are you? Hey, Sophie. Did you hear your name? Huh? Come see me. Hi. Yes, I could just kiss you all day long, but we need to go ahead and give you your exam.
Now let's listen to your heart and see how your heart murmur is doing.
Okay.
She did say the murmur was a little worse. You can have a murmur from a grade 1 to a grade 6, I believe it is. And last time she said her murmur was a grade 3, and this time she thinks it's gone up to a grade 4, which means it's louder.
I'll go ahead and capture all the images of her heart, and I'll measure them later.
Okay.
And then I'll compare to before, and I'll talk to you tomorrow about, you know, does it look like it's progressing or not? Okay.
Sarah Dillow, one of Dr. Berger's regular clients, has brought in her newest adopted exotic animal, Koda. Koda is a coatimundi, also known as a South American raccoon. Sarah thinks Koda may have mange, which can be a very contagious disease and is easily transmitted to humans.
We've had Koda about a month. When we got her, she was in a small cage, no food, no water. Her tail was chewed down to pretty much nothing just from the stress of being in the cage. She was just in bad shape, very stressed out.
Woo, somebody's excited. Hello.
Hi.
Hi. What's up?
When we first got her, she had chewed the end of her tail completely off. It was bleeding, bone was sticking out, so we got her and brought her home.
Any coughing, sneezing, vomiting, diarrhea?
No.
When she was bleeding from the tip of the tail?
Yes.
Okay. Is she chewing anywhere else on her body?
Just on the tail. When I scratch her back, she chews her leg a little bit. I guess like it feels good.
Have you seen any fleas on her at all?
No.
You don't see any fleas either?
No, they had just chewed.
Yeah, you can see the tip of the tail does not have any hair right now. And you said it was further down before.
It's grown back a little bit in the past couple of weeks, but it was bleeding out of the tip.
Yeah, it still looks a little red and irritated. It's scabby. Mange is a mite that lives down in the hair follicle. Basically what it does is the hair comes out in clumps. You're so itchy, it's like having 10,000 splinters in your skin. So you start itching, and then, an animal doesn't know when to stop the itching. So it's biting, chewing, scratching, breaks the surface of the skin. Staph infection, staph that's normally on the skin gets into the bloodstream, and then you get systemic disease and even death from it. We're concerned that this type of mange could be the kind of mange that spreads to other animals, or could have spread even to a family member. It could actually lead to the euthanasia of the animal because we can't have it as a continuous source of infection. Okay. So there's two types of mange. One's called demodectic mange, and one's called sarcoptic mange. Demodectic mange is inherited, and sarcoptic mange is contagious. It spreads to other animals and people really easily. You're fast, but I'm faster. Get a razor blade that we use for the skin scrape, and then we'll look for the mites underneath the skin.
Okay.
Okay, I'll be right back.
Thank you.
You're welcome.
Back at All Creatures Veterinary Clinic, Dr. Berger is getting ready to do a skin scrape of Koda's tail.
Okay. You look very excited about this. So what we have to do is we have to use a scalpel blade to make the skin a little irritated. Let's see how this goes. All right, ready? Ready? It's party hat. It's party hat. Oh yeah. You could still bite through it,
right?
But it just not get us all that crazy.
The skin scrape is used to gather samples of potential mange mites.
I know.
Okay, okay, almost done.
It's all right.
As you can see, when we irritate the skin with a razor blade, it's like skinning your knee. She didn't like it. She tried to get away from it. With exotics, there's only one person that they're trusting. They've really focused on this one person who feeds them and changes their bedding and houses them and bonds with them. So we need to have them in the room to handle these animals.
I got you. It's okay. I promise.
Okay. All right, good.
Dr. Sanger is using an ultrasound on Sophie to determine how severe her mitral valve disease is and whether or not her medication should be increased. Right now, her biggest concern is that the mitral valve might be leaking more.
Whenever you see multiple colors, it should all be one color, meaning it's going one direction. So blue is going this way and red's going this way. So if I see blue and red together, I've got turbulence, and that's what the murmur is. That's what makes the murmur, is that turbulent, you can hear that turbulent blood flow. Her mitral valve just doesn't close all the way. And so when it closes, but there's a leak in it, I can hear the blood flowing through that leak. That's the heart murmur. That's what I can hear.
When I listen to her heart with my stethoscope at home, I wonder sometimes how she can keep going on like she is. It just sounds kind of bad.
Well, one of the things that's true with all dogs, all types of murmurs, is how bad it sounds has almost nothing to do with how bad it is. And that's why we have to do this kind of testing, because this gives me, I can tell you how bad it is.
It took me a few days to get over this when it happened, and after the first echo, I was like watching for her to just drop over on me, and then after a while I decided she wasn't going to, so I've kind of gotten a little calmer about the whole thing.
Good. Yeah, because what you can more realistically expect is that she's going to live with this murmur for a while. I don't know how long that's going to be. Once she goes into congestion, though, that's when we're in trouble. See, look, we can actually, can you see those two leaflets? Opening and closing.
Oh,
Opening and
yes.
closing right there. Okay, I'm done, sweetheart. I'll call you tomorrow afternoon.
That'd be good.
You be at home?
Yes.
Okay. And we'll go over the results and then make a plan.
Okay.
Okay?
All right.
You're the best. This valve is going to get worse over the years, but I want her to be 16 years old before she has congestive heart failure. So if we stay on top of it, maybe we can slow down the process.
When something like this even happens to your animal, it does make you appreciate the time that you have right now. And then when her quality of life is bad enough that, you know, we don't want to go on like that anymore, then we have to look at euthanizing her, I guess.
Dr. Berger is reviewing Koda's skin scrape sample under the microscope to determine whether or not she has mange mites, which could be extremely contagious to Sarah's family and other pets.
So we've taken the sample from Koda and we looked at it under the microscope. We did not find any mange follicles. We found a lot of white blood cells and bacteria. So it does not appear that she has mange, which is great. But she does have a really serious staph infection that's almost into the bone. It's definitely been in the bloodstream, so we need to get her treated right away. The good news is no mange.
Okay.
So we checked both for the demodectic mange, which is the inherited kind,
Right.
and the sarcoptic mange that's contagious, and negative for both of those. So at this point, what we're going to do is we're going to use an antibiotic injection, a special antibiotic that'll last 2 weeks, and we're hopeful that this will cure it, or at least delay the effects of the staph till the body can heal some and she can get some good relief from this.
It's a really good thing to get that under control. I mean, it could have really gotten out of hand, could have spread to my family, could have gotten a lot worse for Koda. And now that it's not mange, it's something we can take care of a lot faster.
All right, so we're just gonna go back here. No. Hide her with Mom. Forgot how fast you are.
I know, sugar. I'm like, no.
Okay, all right, ready? Okay. As you can see, when you're handling these exotics, I mean, they're not very domesticated. They're not like a dog or a cat. And if we trap them and we're not physically correct with them, meaning we don't give them the time to adjust to us and us to adjust to them, then they're going to lash out. They're going to bite. They're going to scratch. Okay, ready? Okay. I don't want to see her struggling.
Okay.
She obviously is not happy with this injection we're trying to give her, so rather than see her struggle, she's already a stressed out animal, the owner's stressed out, and we don't want her to get too much stress. We're trying to relieve that stress, so we're going to switch to an oral medication. It'll take a little longer to work. It'll still have the same effect, but decrease the stress of the animal greatly.
So you gotta hold still, girl.
So we're going to adapt. We're going to give her an oral medication instead, since she doesn't like this. So I'll take this off of you. There you go. I know you're mad. You can go calm down.
It's
We'll
not
send her home with some pills instead. That'll make everybody a lot happier.
Dr. Sanger has reviewed Sophie's ultrasound results and is ready to make her diagnosis.
So I've looked at Sophie's heart and I have done the measurements on the different chambers, and her heart is no worse than it was 4 months ago. So obviously her mitral valve disease is progressing very slowly. In the meantime, it is possible that her heart would start to progress into failure before I get to look again. So her mom, Sarah, who is a nurse, knows to watch her respiratory rate when she's sleeping and count it. How many times is she breathing in a minute? If that number starts to go up over time, then she might be starting to get some congestion. So that might be the first sign that her owner would notice. Right now she's on a medication called benazepril, and what it does is it just decreases the resistance that the heart has to pump against. So it just makes life easier on the heart. So it's gonna do better longer.
I guess because I'm a nurse, I don't believe and I don't want to let her get really, really, really sick. Statistically, she would live another year or two, she said, or it could happen tomorrow. And that's what I've made peace with, and every day we wake up, you know, well and happy and healthy. That's another day to be thankful for.
Okay, Koda, did you calm down? Do you like me again? What? It's not a grape. I'm sorry, it's not a grape. I'm sorry. You're fast, Koda. So this is one a day. And if she likes grapes, then you can just stick it inside of a grape. It's a 2-week supply, so by then you should see that hair fully returning, and that little bald spot should go away.
Awesome.
Okay.
Sounds good.
All right, have a good day.
Thank you.
You're welcome. Good to see you.
Thanks.
With proper nutrition, rest, and medication, Koda should be able to recover from her staph infection. Dr. Berger will follow up with Sarah in a month to make sure she is completely healed. It's been a little over a month since Koda's visit with Dr. Berger, and her health has drastically improved. Her hair has grown back on her tail, her skin has healed, and she is no longer nervously scratching herself.
Come on, up, good girl. We put a tire swing in there with her. She's got ramps, she's got boards to run across, ropes. Her enclosure's big enough that we can actually walk in and, you know, interact with her one-on-one. We can harness her and hook her to a leash, and we do take her out for exercise, you know, in the woods on trails and things like that. She loves that. So making sure that we spend a lot of time with her is really important. Come on, up.
So you haven't seen any more signs of itching?
Not that I've noticed.
And it looks like her tail is beautiful. Really grown back nice. Strong tails.
Right.
Now we have a Codamundi that's happy, running around, content. The tail has no more evidence of any kind of infection. The tail's full of hair. Heart sounds beautiful, the lungs are great. Skin looks totally different. You can tell she's not been chewing it, not been itching it. You checking my skin out? Want to check your skin out? Okay. She's changed from an animal that was irritated, upset, somewhat aggressive to eating marshmallows out of your hands. Okay. Sarah's feeling good because A, we made sure that there was no mange going on, which is fantastic that that wasn't there, and B, we prevented the infection going into the bone, and C, we prevented the sepsis from spreading to other parts of the body that could have been fatal to the Codamundi. So you're doing a great job with her.
Thank you.
It makes you feel great. It makes me feel really happy that we were able to help her.
Have passed since Sophie came in for her ultrasound. Today, she's back for another follow-up exam. Although her results were stable during the last visit, it's possible her heart murmur has gotten worse, and she may be inching towards congestive heart failure.
I'm hoping that everything will be the same as it was, because we know it won't be any better, because it will only get worse over time.
Hey, Sophie.
Hey, Dr. Sanger,
Hello.
how are you?
Good. How are you doing?
Good.
Good. Hey, honey. Can I have a
Sitting on her tail.
I'm sitting on your tail. Let's get you up on the table, and I want to take a good look at you so we can see how you're doing with your head. Okay. Her heart rate's in the normal range, which is really good. Okay, so the next step is to get some blood work
Okay.
and some x-rays.
Okay.
We'll send the blood work out to the lab. Well, you can call me for results in a couple of days. And hopefully that'll all be normal, meaning she's tolerating the medications okay. And the x-rays we can go ahead and look at in about 10 minutes, and we'll look at them together and
Okay.
see if her heart is expanding or staying the same.
Okay.
Sophie's blood is drawn to find out how well her body is tolerating the medications. She is then taken to radiology for x-rays of her chest. This will allow Dr. Sanger to see if her condition has worsened.
Okay, so here's her heart, right here.
Okay.
And this is what we're gonna measure and compare to last time. So her vertebral heart score is what we call 13.5.
Okay.
Normal's 10.5. So, and that's very similar to how she was before.
Okay.
And that's exactly what we want. We want it to stay the same.
Wonderful.
So, status quo for now, and let's just keep checking every 3 to 6 months.
Okay.
And then we'll change things as she changes.
Okay.
Unless you notice increase in respiratory rate between now and then.
And then if I notice anything, you want me to come in, right?
Oh yeah, absolutely.
Okay. Okay.
All right.
Thank you.
You're welcome. Thank you so much.
I appreciate it.
Are you ready to go, Sophie? She's like, yeah, just let me go.
Well, I feel relieved. I really do. I'm going along, think I'm fine, but when something like this happens, that's really good news. So I feel much better now.
Sophie's going to continue to be monitored every 6 months. Basically, we're just going to be watching that heart size, and if it's changing, we'll get the ultrasound probe back on that valve and see how that's changing, see if it's leaking more, and try to catch congestive heart failure the day it happens. If we can catch congestive heart failure the day it happens, they can live longer. The medications work better. Sophie's so cute. I love King Charles Cavaliers because they're adorable, and I hate that this happens to them. But Sophie doesn't know she's sick. Let's keep it that way.
At first, I just kept watching her, and I was worried all the time, but now I've kind of learned to, just take it as it comes, and that maybe it's not going to happen right away. Things are not going to deteriorate now, and so I'm just trying to enjoy the time that everything's good.
Today on Rescue Vet, an arthritic 10-year-old Argentine mare is suffering from joint pain. Will Dr. Berger's alternative healing process be able to save this majestic horse from being put down, or is her condition too severe?
I have had to put horses down because of pain, and it's like putting a child down.
A diabetic 12-year-old Chihuahua pug mix with a leg injury has been taken to the hospital for surgery. But if the procedure is too risky, the owner may be left with one option.
Money's tight right now. The risk involved in the surgery is something we have to think about as well.
Today, Dr. Berger is visiting one of his longtime clients, Rose Cease.
I've been taking care of Rose's horses off and on for about 15 years.
I met him when my equine vet, who was probably one of the top vets in the country, retired, and Dr. Berger was his hand-picked protege.
Rose owns and boards several horses at Boone Hall Plantation in Mount Pleasant, South Carolina. Many of the horses also compete in polo.
Polo in South Carolina is actually a huge entity, and the horses add a lot of ambiance to our guest experience. They are quite the spoiled princesses.
Rose noticed that one of her newer horses, Caprichosa, has developed a problem with her gait, which has prevented her from playing polo.
We knew we had some issues that need to be resolved before she was going to be happy and playing well. They're telling you that they're in pain. You just have to listen to them.
Today we came out to this farm to look at Caprichosa. She's about 10 years old and is suffering some severe arthritis in her back end.
Typically, horses are treated with medication and steroids for joint pain. But that is not a cure and can often lead to more problems.
Steroid injections are a quick fix, but eventually the steroids will disintegrate the integrity of the joint, so you actually end up with a worse joint than when you started.
There's a couple of really bad things that can happen. First, infections from injecting the joints can get systemic, and there's no treatment for that. I mean, they have to be put down. You know, all the medications can cause ulceration in the intestinal tract and lead to such intense pain that the horse rolls, twists its abdomen, and then you end up having to do, you know, an $8,000 to $10,000 surgery, which has a low probability of success.
Dr. Berger will examine Caprichosa by applying pressure to her back to see where she is experiencing the most pain.
First thing we're gonna do is palpate her back and see if she has a response, which she puts her ears back and looks at me like she wants to bite me.
Running his hand over the horse, he could feel the energy and he could feel what that horse was going to let him do and how to gain that horse's trust.
Flickering the tail, putting her ears back, looking around. That definitely hurts. No, I'm barely touching her.
Yeah.
I couldn't break an egg.
She's uncomfortable.
Yeah. When we touch this mare's back, she practically wants to drop to the ground because it's so painful. So for us to just be able to, with our little hands, be able to bring a horse to its knees with pain, obviously indicates that there's something severe going on.
Dr. Berger stretches Caprichosa's legs and applies pressure to the joints to test her reaction once again.
Check these lower joints and upper joints. You can see when I flex this front leg that she reacts. She doesn't like it. Check this leg. Check her shoulder. There's joint fluid that's building up in that area, and that's an indication of some chronic severe arthritis. So I'm going to hold this for a little bit. Try to.
Oh, she's definitely laying her ears back on that one.
It just doesn't like that.
You know, if a horse is in pain and stumbles and comes on top of you, I mean, it can even be a life-threatening situation. So it's not just that you don't want to see them in pain, but it's actually, you know, a personal safety issue. So it's really, really important that they're happy, that they're healthy, that they're pain-free.
So she's getting a little shy from me poking her. Scoot over, babe. Good girl. It's all right. It's okay. So all in all, I think that mainly her issues are more in her back than anything. So we'll flex her out, and then we'll jog her off and see how she does. When we jog her off, she doesn't want to move. And that's an indication of pain. And not just mild pain, but pretty severe pain. Not really wanting to do a whole lot. Good. So you saw it took 5 steps before she wanted to do anything. I mean, horses are majestic animals. Seeing them in pain, seeing them suffering, it's a really hard thing to see.
There are some cases when you do what's right for the animal. And if your animal's in pain, you have a decision as an owner. And I have had to put horses down because of pain. And it's like putting a child down, or your animal, your dog. You have to do what's right for the animal.
Matt Hall from Mount Pleasant, South Carolina, has brought his 12-year-old Chihuahua pug mix Jack to veterinary specialty care because of a leg injury.
He was coming up the steps in the backyard and just stepped wrong and tore something in his knee. And he started squealing pretty good and then won't use the leg anymore.
Jack's regular veterinarian was able to see him after the incident, but was unable to treat the injury.
She noticed that the kneecap was out of place and that the knee was really loose, so she suspected a tear in the knee and said we need to just get straight over here because it wasn't something they were able to fix at their facility.
Jack is taken to radiology to find out how severe the injury is. Dr. Bianucci has reviewed Jack's x-rays and must decide what the best procedure is for Jack.
Basically, the alignment issue there is it's that this little bone right here, which is the kneecap or the patella, It acts as the gliding surface for the quadriceps, okay? So when you have to bear weight, you flex your quadriceps, and that's how you straighten your leg. Over the years, this thing has been popping out and internally rotating this leg. And so over time, it accelerates the wear on the cruciate ligament, and that's why that tore. So now we have two problems on the same leg. The torn cruciate ligament and the patellar luxation.
There are two different ways to operate on Jack's knee that will fix both of his knee issues. The newer technique, called a TTA procedure, costs more, but the recovery time is faster. The older technique, called a fibular head transposition, is usually just as effective and costs less, but recovery time can take longer. Because of his small size, it will also be a challenge to fit a plate on his knee.
What we do, oh buddy, it's okay.
Aside from the fact that Jack is 12 years old, he is also diabetic. The combination of his age and health issues can create huge risks during and after surgery.
Diabetes does predispose to wound infections, and they can have slower wound healing. So those are some of the issues that you deal with. The cost of doing the newer technique is more than the older technique. I think the benefit to it is that they feel better much sooner and they heal in about half the time. As far as long-term function, still a little bit up in the air, as to whether they actually do better with that newer technique. In my experience, they seem to. Okay, they seem to be doing better with the newer one.
I'm most concerned not being able to afford the surgery. It's a lot of money. Money's tight right now. And he is a 12-year-old dog, so the risk involved in the surgery is something we have to think about as well.
Matt will have to make a tough decision and figure out which option is best for Jack. There are many life-threatening risks involved in surgery, but without a working leg at such an old age, Jack may have to be put to sleep. Jack's owner, Matt, has decided to go forward with the surgery despite the risks involved. He is leaving it up to Dr. Bianucci to decide which procedure is best. Veterinary technicians prepare Jack for anesthesia. Anesthesia is often risky for older, diabetic dogs like Jack.
Very sorry. Oh, it's okay.
Anytime something's going under anesthesia, there is always the risk that something could happen. But we recognize that every time you give it, they may stop breathing, and you have to be right on top of them. And there are other individual reactions to drugs and anesthesia. In many cases, it's the life-threatening part of a surgery.
Before determining which procedure is best for Jack, Dr. Bianucci must measure the plate that will go on Jack's knee.
That'll fit fine.
Dr. Bianucci decides to go with the newer technique called the TTA procedure. The outcome usually involves faster recovery, but it is also more expensive than the older procedure. It is crucial that the veterinary technicians monitor the anesthesia while Dr. Bianucci operates on Jack's knee. The procedure will help correct two problems, the torn cruciate ligament and the patellar luxation. However, Dr. Bianucci is having trouble contouring the plate and decides to go with the older procedure instead.
We were going to do a TTA procedure, but the dog's very small, and although the plate would have fit, you have to do some funky contouring with that plate to correct the kneecap problem at the same time, because the problem also was that this kneecap was popping out of the joint. I was afraid that we were going to have persistent problems. This is kind of an older but reliable way of doing this.
Although recovery time is longer with the older procedure, it appears to be the best option for Jack and will also save his owner money.
I think he'd be happy with the prognosis, and I think it probably doesn't hurt that the procedure we chose is about $700 cheaper than an alternative procedure, and I think it was the right procedure for that dog.
Jack will be kept overnight and monitored by Veterinary Specialty Care's 24-hour staff as he recovers from surgery. It is important that a close eye is kept on Jack, especially because of his old age and diabetes. Back at Boone Hall Plantation, Dr. Berger has decided to treat Caprichosa's pain with acupuncture needles instead of using steroids and medication.
And, you know, you could just see, just touching her, how she's swishing her tail and doesn't like it. So we'll get some needles and put them in there. So these are the needles we're going to use. Let her see them, see what she thinks about it. What do you think about it? Yeah? We're going to start with what's called dry acupuncture, just putting acupuncture in the needles. We're going to put them all in the back muscles. We're also going to do some points in the head. So basically we're putting the needle in through the skin right there. We're just going to gently push it in a little bit.
Looks like she doesn't mind it.
No. I've been doing acupuncture for 15 years. It's something that started off slow because the community wasn't really ready to accept it yet. But now we do acupuncture every day in the practice. It's going to basically increase serotonin levels in the brain, so you know you're not feeling sad because of your pain. Endorphin release so that the inflammatory mediators can leave the joints and basically get out of the body. And then a direct effect on the neuromuscular junction. You let the joints get back to where they need to be.
She just had a nice big deep breath.
Yeah.
Oh, look at that, Doug.
Yeah.
She's chewing.
Chewing and licking is generally a neurological response to pain relief.
All of that gives you an immediate sense that it's not hurting the horse at all. They actually are getting a great benefit from it.
If she'll let us, we're going to put this up here. And this is really a great spot for increasing serotonin. You see her dropping her head?
Yeah.
I mean, I'm not pushing down on it. That's her doing that. So this releases a lot of the serotonin in the body, a lot of the endorphins that are trapped. And they, you know, when you got the spot, I mean, this is it. Lower lip's drooping. It basically looks drugged, if you will, but it's not. It's just the feel good from the endorphins.
Oh yeah, look at her lower her head down. She's going to sleep.
So we'll let those sit for like about 5 or 10 minutes, see what her body does with them.
At Boone Hall Plantation, the acupuncture needles are already starting to relieve Caprichosa's pain. Dr. Berger is hopeful that acupuncture will replace the need for steroids and other harmful medications.
We're going to use some heat to sink the acupuncture in, so we're going to use this stick called moxa, basically, to heat up this herb and put it around the needles in order to sink the acupuncture deeper into the horse. Get more of an effect. It's kind of a stimulant for the needles.
She must like it. She's got her head down low. Her eyes are kind of half asleep.
You can do steroid injections every 6 weeks or surgery to try and relieve the pain. And then you have a horse that is not good anymore. And she can't do what she wants to do. And we hope for this, that you'll have her for another 10 years of good, pain-free existence.
The needles will stay in for 5 more minutes before Dr. Berger runs some more tests on Caprichosa. Jack has successfully made it through a couple of nights at veterinary specialty care after recovering from surgery. He is now ready to go home to his family.
Who's that? There's little Jackson. Can you give Jack a kiss?
Can you give me a kiss?
No. I'm shy about that.
Okay. Okay.
It's very emotional. So he, when he's away from us, he gets a little upset and he pouts at you for a couple of days.
Yeah. All right.
Surgery seemed to go really well. Glad everything worked out the way it did. It turned out much better than what we expected because we came in not knowing if we were going to have to put him to sleep or if they were going to be able to fix it. They used the older procedure in this case, which is less expensive.
Give Jack a hug. Mason, give him a hug. Give him a kiss. No, you're going to be shy.
Jack went home just a few minutes ago, and that really went very well. I did go with an older technique and to repair that knee because I felt it was going to be less likely to have complications. But despite that, you know, I have a very favorable prognosis, and Jack was doing great today, as well as expected.
It will be a few months before Jack is fully recovered, but after receiving the proper care and medication, he should be walking again soon. It is now time to remove the acupuncture needles to see if Caprichosa's pain has diminished.
It's funny. Tug on that a little bit. See how tightly they keep it in?
Oh, wow.
The other thing that's interesting is if you look at this needle, it's bent. The body will bend it to where it needs to go. You see that one consistent again? So she's very consistent. Like that? Okay.
I think so.
Dr. Berger flexes Caprichosa's legs to see if she is showing any more signs of pain or discomfort.
Yeah, she doesn't look like she minds it at all this time.
She's not pulling me all over the place. All right, so we're going to jog her right out that way. Whenever you're ready.
After Dr. Berger took the needles out of Caprichosa, you can notice a much more free-flowing stride. She's feeling good, she's feeling relaxed, she's not in pain. Yeah, no hesitation that time.
No hesitation at all. Take a horse that's obviously stressed out, in a lot of pain, and by using the acupuncture needles appropriately and the moxa, you've got a horse now that's relaxed, that when you test his joint runs, instead of needing encouragement, just takes off, and obviously is a much more bright and alert animal. I think if she could talk, she'd be saying thank you. Can we avoid steroids injections with her? Probably, with just doing that. So I would say that she's gonna be a good long-term candidate for it.
She's nice and happy. Happy horse.
We find after a while that we can maintain them with 3 treatments a year. So 3 treatments a year from a financial and physical standpoint is a heck of a lot better than having to have their joints injected every 6 weeks at a high cost. Eventually the back's going to tighten up a little bit again, and we will probably have to redress the joint issues, but we're hopeful that all it's going to take is using the needles, and that's it. I love seeing owners that are satisfied, horses that have gone from being painful to being relaxed, and that's why we're here.
Everything was great, and I anticipate that she will be playing many, many more years.
Remarkably, Caprichosa's pain has dissolved without the use of medicine or steroids. Rose will continue to use Dr. Berger's acupuncture treatment on Caprichosa until she is fully recovered and able to play polo again. 3 months have passed since Jack's knee surgery. He has recovered faster than anticipated and is able to walk and run again despite his diabetes and old age.
Good boy. Jack's doing great. He came in for his recheck. Apparently the kneecap is tracking exactly where it's supposed to.
Surgery went really well. He's healed up really well and done a real good job. Dr. Bianucci's been great. I've actually recommended a friend of mine for his dog to have the exact same surgery.
He's just moving forward with what he's got. His attitude's just the same, and he should function well on it, so that makes me happy.
If he wasn't going to do well with the surgery, I think it would have been too much trouble for him getting around and having any kind of quality of life. We were really concerned that we were going to have to put him to sleep. He's been such a big part of our family that'd have been pretty tough. Having to explain to a 2-year-old why the dog's no longer there, I don't even know how to do that. These breeds generally live about 15, 16 years, and I think he'll make it at least that long.
More than anything, it shows you what a part of the family these guys are. You know, it shows you that even a little kid feels more complete when he gets his little family member back.
Yeah, you gonna get him? Go get him.
You want to take him for a walk?
Today on Rescue Vet, an 11-year-old Dalmatian is unable to open her jaw without experiencing pain. Is a cancerous tumor the cause of her discomfort?
With the type of tumor that this most likely is, the prognosis is really not good.
A 9-year-old French bulldog has been struggling to walk for months. Will an MRI result in a prognosis worse than anticipated?
I'm not going to be one of those people that if he is in pain, that
I'm just gonna drug him up and keep him around.
Veterinary Specialty Care has relocated from a 6,000 square foot building to a brand new 15,000 square foot building. The new building includes rooms for fluoroscopy, endoscopy, chemotherapy, ultrasounds, x-rays, CT scans, MRIs, physical therapy, 4 operating rooms, and 15 exam rooms.
We've made vast improvements in our operating room capacity and the quality of the equipment in the rooms, and the facility overall has just been a massive upgrade.
Dana Wurstler and her 11-year-old Dalmatian Lulabell have taken a 2-hour drive from Florence, South Carolina to Veterinary Specialty Care. A few weeks ago, Dana noticed Lulabell was experiencing pain when moving her mouth.
When she would yawn, she would begin to yawn and then stop. She was having difficulty eating.
After recognizing that Lulabell was in pain, Dana also noticed a mass on her jaw.
I finally went to the veterinarian in Florence, and when they started looking at it, it was something that they could not handle, and they got in contact with the doctors here, and then I made an appointment and we came down here.
When the mouth opens, part of the mandible swings forward under that arch, and if there's a mass there, it will interfere with that. So we're not sure if it's that the mass is interfering or if somehow this tumor is actually involving the bone of the mandible.
I feel scared, really scared. I'm hoping for miraculous recovery and everything is great, and she looks fine, and she's my dog, I love her.
To determine where the mass is located and how big it is, a CT scan will be taken of Lulabell's jaw. This will also help Dr. Bianucci navigate around the mandible more accurately during the surgery. A referral case from Bees Ferry Veterinary Hospital has come to Veterinary Specialty Care. Kelly Atkinson is here with her 8-year-old French bulldog, Logan, for an MRI with Dr. Brofman. Logan has been having trouble walking and appears to have a neurological disorder.
It started a few months ago. He started limping a little bit. We just started walking him and exercising him a little bit more 3 or 4 times a week, and it wasn't going away because the doctor said it could be arthritis. And then taking him back to the vet, they said it could be a pinched nerve. And then it just kind of, a couple of months ago, just went downhill where he was, losing control of his bowel movements. He was falling down, and he fell down the stairs one day, and we took him to his regular vet at Bees Ferry. They suggested we bring him here.
So they sent him over here for an evaluation by me for his neurological problem. But the thing I am most suspicious of affecting Logan is a malformation of the spine, which we see pretty frequently in French bulldogs, and that often causes compression of the spinal cord and causes the signs we're seeing. However, there's a number of other conditions. We may see an infection or inflammation, tumor, or even a disc protrusion.
The next step, or possible steps, would be surgery or chemotherapy, depending on what it is. And just the thing is keeping him happy and not in any pain is our main concern. And it's killing me at this point. I usually don't come to the vet visits because I usually have a hard time, and I come tissue in hand ready. I just don't take it well. I'm just scared. I'm scared to find out what it is.
Hey, how are you doing?
Good, how are you?
All right, good. Hey, bud. All right. So yeah, we'll be able to get started right away. We'll take Logan on back and get a catheter into him. And you want to give him a kiss?
Yeah.
Okay. And I'll carry him. I'll carry him on back. All right. All right, we'll take good care of him. I know you're worried, but.
And we all put this with him when he's.
Sure. All right. We're going to perform an MRI, and hopefully the MRI will show us what is causing the abnormality in his spinal cord. Is it something compressing the spinal cord from the outside that we may have to do surgery to remove, to decompress the cord, or is it something inside the spinal cord that would require more medical management?
It's more about quality of life for me. I'm not going to be one of those people that if he is in pain, that I'm just going to, drug him up and keep him around. But if he's not in any pain and he's still happy, I'll do what we can to keep him around.
Dr. Brofman is conducting an MRI on Logan in hopes of determining the root of his neurological problems.
This is the spinal cord running along here. And what I'm seeing so far right now is this little area of whiteness. So that's fluid of some sort, bruising, fluid pockets from chronic injury. We'll have a better idea once we get some more images as to what this is. But this is what I'm seeing so far, and then I'm going to have to get some more images further up. The major concern I have is this mass or abnormality inside the spinal cord, which would be most consistent either with a spinal tumor or some sort of inflammation of the spinal cord. Is there something compressing it, or is it something going on inside, like a tumor is one possibility. It's just not sure if it's going to be something inside the spinal cord or on the outside pushing on it, causing that sign.
After reviewing Lulabell's CT scan results, Dr. Bianucci has discovered another concerning issue with her jaw.
Not only is Lulabell dealing with the pain of a destructive tumor in the bone, but she also has a fractured jawbone as a result of the tumor. So we're going to take out essentially this entire quarter of the mandible.
With the type of tumor that this most likely is, and we'll confirm it, but the prognosis is really, it's not good. These things tend to come back. This is most likely osteosarcoma, and these are tumors that tend to recur. This tumor is interfering with this dog's ability to open its mouth, and so it's making eating painful. And so, the dog would still have some time if we didn't do anything, but it would be uncomfortable time. And so the hope is that, what we're doing here is going to alleviate that discomfort, and then we can figure out exactly what kind of cancer this is and potentially treat it with chemotherapy. They can live with just one side intact. So you can take one half of the jaw out, and they can do fine with the remainder. There's some significant nerve structures here that we need to worry about too. It's a small space, and there's lots of nerves and lots of big blood vessels. So you always have to move very slowly. The soft tissue part of this tumor is even a little bigger than it looked on the CT scan even. So it's a really big mass. It goes in towards the inside. We can definitely get it, but it's a little bit larger than it looked on the CT scan. I suspected osteosarcoma because of the way it was affecting the bone, but this could be any kind of sarcoma.
At Veterinary Specialty Care, Dr. Bianucci is trying to safely remove the mass from Lulabell's jaw before excising the fracture in her mandible.
Here's the tumor, all here under these muscles, and then down here on the jaw. So So we've taken away this arch of bone right there, and now we're going to the mandible, which is below it, and we're going to take out this back section of that. So this is where we are now. Okay, now we're going to actually do the osteotomy. We're making our first cut into the mandible. The mandibular part is out. So this tumor filled that whole space and had actually fractured the bone. Well, I think we did a good job here. I think we got everything out that you can see. We're going to just try to put everything that remains back as close as possible to where it started. These guys really bounce back pretty quickly, surprisingly fast. So my hope is that we're going to be sending little Lulabell home tomorrow.
After the surgery is completed, Lulabell is transferred to recovery, where she will remain until she's ready to be released. Dr. Brofman has finished Logan's MRI, but is still unsure of the diagnosis. The next step will be a spinal tap to help solve the mystery behind his neurological issues.
So what I'm doing now is I'm going to be doing a spinal tap to get fluid from around the spinal cord. So right now what we have here is spinal fluid dripping from the needle. And so the spinal fluid is the fluid that kind of bathes and surrounds the entire nervous system. And the purpose of obtaining this is there's some non-specific swelling in the middle of the spinal cord, so on the MRI, so possibilities include a tumor, an infection or inflammation, potentially even just chronic trauma if there's instability there. But this just helps give us a more complete picture of what's going on. So what I'm doing here is trying to remove fluid without also getting the blood that is contaminating the sample. With Logan's condition, the prognosis is somewhat guarded. We're not entirely sure without doing a biopsy what exactly it is. If it's a sterile inflammatory process where the immune system becomes hyperactive and attacks the nervous system, the long-term prognosis on average, dogs live about 1.5 to 2 years. If it's a spinal tumor with just medical management, it may progress over even just a few months, 3 to 6 months, but there are other treatment options such as radiation therapy, chemotherapy, which could extend that survival time, but still it's something that they do eventually succumb to.
Although the diagnosis is still unknown, Dr. Brofman will have to tell Kelly that Logan's lifespan will most likely be cut short.
I knew it wasn't going to be good news, but he's not hurting right now, so that's what's important. So we just get to go home and see where we go from here.
After I discussed Logan's finding with Kelly, she was quite upset. She was crying and understanding at the same time. She was a bit overwhelmed, though.
Kelly will have to process the news before she and her husband make any decisions. Without a definitive cure, it will be hard to decide if chemotherapy is a step in the right direction. 2 weeks have passed since Logan's MRI. Today, he is back in for a follow-up exam with Dr. Brofman.
For the past 2 weeks, he's been on some prednisone, which is a steroid to decrease the swelling in the spinal cord. And we had discussed 2 weeks ago the treatment options that were available to him. And she's had some time to think about it, and she just wants to come in and talk about the options again and to help her make her decision.
When we first found out what it could be, 2 weeks to process it and think about treatment and see how he's been reacting to what he's on has made a difference. And he's still a happy dog, which is very important. I know that chemo won't necessarily improve it, but it could, and that he can live out his life instead of having some disease take it.
Hey, bud. So how are things going?
About the same.
Yeah? Okay. Let me have you I just want to see him walk a little bit. Right now I'm watching Logan walk up and down the hallway, and after a couple weeks on the prednisone, he may be a little bit better, but really not all that significantly. He's still quite weak and incoordinated, so what we'll probably have to do is increase the dose of prednisone while Kelly is deciding what treatment she wants to pursue. And so you haven't noticed any other problems, though? No, nothing affecting his front legs or anything like that?
No.
So the whole purpose of the administration of the steroids is to decrease the swelling in the spinal cord, and that will hopefully lessen the disruption of the signals that go from the brain to the legs, and then that would result in a more coordinated ability to walk and less weakness. So basically, it's either going to be a spinal tumor or this sterile inflammation of the spinal cord. We don't know exactly what we're treating, but to get a biopsy of it would just cause more problems than solve.
Will there ever be a sign that'll tell us which one it is, or?
No, unfortunately not. I think that if other parts of the nervous system started to be affected, I'd be leaning more towards it being the inflammation, because usually the types of tumors we see inside the spinal cord in Frenchies like that would be very unlikely to spread to other parts of the nervous system, whereas the inflammation would be more likely to. If it is the inflammation, there are some dogs that, can, like I said, on average, 1.5 to 2 years, but there are some dogs that are out there 3, 4, 5 years and seem to be, cured or on lifelong chemotherapy and or prednisone. So, yeah, I mean, they can do well. It's just really variable from dog to dog. But I think in the meantime, definitely let's bump up the prednisone to once a day.
Okay.
Okay. So let me get you the prescription for the prednisone, and then you can talk to your husband and send me an email, and we can make a decision.
Okay.
Okay? All right. Kelly is going to discuss with her husband the different treatment options we discussed again, and see if there's any more questions, and based on what they want to do, we'll proceed with either one of several chemotherapy options or just the steroids alone. From working with Logan and Kelly over the last couple of weeks, it's definitely obvious how much Logan means to her and her husband and how attached they are to him. And so that makes it hard when I don't have good news for them. I'm hoping that I'll be able to help at least somewhat with the medication and prolong his life as much as possible for them.
We can up the steroids and then try chemo, which my husband's kind of reluctant to do, because when you think of chemo, you think about humans with cancer and how it, destroys their body. But there's supposed to be little to no side effects with the chemo shot, and I think that'll be our next step if it starts to get any worse.
It's been a day since Lulabell had her surgery, and Dr. Bianucci has cleared her to go home with her family. He won't know if the tumor is benign or malignant until the biopsy results come back. But at this point, there is a strong inclination that it is a fatal tumor.
First of all, I wanted to show you what we did. Okay. What the procedure was. Now, the tumor was here. Okay. It looked like this bone was being pressed against by the tumor. So we took this bone off here, okay? And then we went to here and we cut right there. Now this bone is missing now, so she does have a little bit of a divot on the side of her face. Once this is all healed, she should be able to eat normally. Okay. Great. So I know this is hard and sad, but once we find out what it is, that'll give us a guide in terms of what we're gonna do next.
I had said, and I told my friends, I said, look at her, she just looks like she's in pain.
Yes.
And she would just stand there like she was moping.
And that is a really painful thing for these guys, because every time they move their mouth, it hurts. So, we'll keep our fingers crossed in terms of what the biopsy is, because that's going to be the big determinant in terms of what we do next and what the prognosis is, okay? And again, I should have that back in about 3 days.
I feel better because she's not going through the pain of everything.
I think that things went really well,
And I think that Lulabell is going to feel better within a few days, certainly much better in a few days than she has for the past few months.
The worst case scenario would be that she would have to have chemotherapy. I'm kind of considering not doing the chemotherapy because I've seen people go through that and it's very, very tough, very hard.
Even if this turns out to be a bad tumor and this is a short-term prognosis, by short, 6-8 months, I think there'll be 6 or 8 comfortable months for her.
I'm not sure what I'm going to do. It's going to be a hard decision. It's going to be really difficult.
The tumor came back as a fibrosarcoma, which is not good news. It's better than some tumors. We discussed the options of radiation or chemotherapy, which could potentially slow down the recurrence. Probably wouldn't cure it, and I think the owners decided that what we've done is going to be as far as she's going to go. I'm optimistic, though, that we're going to get a good, extended period of time out of this. It could be, it might only be 6 months, could easily be a year, could be 2 years. She's much more comfortable. She's eating, she's yawning, she's barking. She's much more comfortable than she was. So it's always nice to see that payoff, to have a very short period of discomfort followed by hopefully an extended time of comfort and ease.
Today on Rescue Vet, a Cavalier King Charles Spaniel goes in for brain surgery after his owner discovers a rare condition that may cost him his life.
The seizures could be to the point where they could be uncontrollable, to the point where he could maybe even die.
A Jack Russell Terrier with a variety of health problems is taken to Bees Ferry for an ultrasound to determine what is causing her liver enzymes to be so high. Is it possible the diagnosis is pointing towards cancer?
She's lost so much weight, she's gone from 20 pounds to 15.7.
Yeah, and it worries me.
Dr. Stacy Bostian, a local veterinarian, has taken her 5-month-old Cavalier King Charles Spaniel Putter to veterinary specialty care for a craniotomy. After noticing a lump on Putter's head, he was taken in for an MRI and diagnosed with a dermoid cyst, which is very rare for this breed of dogs. The MRI showed that the cyst had entered through the skull and into portions of Putter's brain.
This being actually in the brain is not a surgery that I, in my practice, would be able to take care of. Sometimes as a general practitioner, you actually need the help of the specialist.
Today what we're going to do is do surgery to remove the abnormality along the skin and follow it along the stalk that will extend down through the skull.
Today just kind of is going to tell me basically the quality of life that he's going to have from here on out. If we can go in and basically get the entire cyst, then that will give him basically a perfect life. If we can't go in and get the entire cyst, then he may be prone for seizures down the road. The seizures could be to the point where they could be uncontrollable, to the point where he could maybe even die.
If all goes well with the surgery, Dr. Bostian will be giving Putter to her dad as a gift.
After losing a family pet that was my dad's best friend, it was very hard for him to think about having another pet. They haven't had a pet in 15 years, so he's finally decided that it was time for him to have one of his own.
She just didn't want to give them a puppy that had problems, so she just wanted to make sure everything was taken care of before they took him over and got extremely attached to him. I think it was very thoughtful of her.
Good morning.
How are you doing?
Good.
He looks good. He's all set for today?
Yeah, he's doing well.
All right, so I'll take him on back and get the IV into him and get everything set up, and then we'll be right back.
Perfect.
Come here, buddy.
Before the surgery begins, Veterinary technicians administer a sedative.
Oh, buddy, I'm so sorry. That breaks my heart.
He gave me the option to scrub in so that I could be a part of the surgery today, so that I could watch and basically go in and see what's going on and be involved.
This is a nerve-wracking procedure for a number of reasons. One, it's brain surgery, and so there's always the risk of complications with that. Secondly, it's a young puppy, and then lastly, it's a colleague of mine. It's a local veterinarian as well. So there's multiple reasons to be a little more anxious about it.
There's the risk of the outcome of not knowing the long term of his life as far as quality of life, even if the procedure is successful. But there's also the risk of anesthesia. So hoping today goes well, and just gonna watch him closely and know that they'll take good care of him here today.
A 15-year-old Jack Russell Terrier named Savannah, who has been a patient at Bees Ferry Veterinary Hospital since she was born, is brought in for a follow-up. Over the last couple of weeks, Savannah has had an ear infection, a loss of appetite, and a decrease in activity levels. She also has high liver enzymes, which can be fatal if not treated quickly.
She has vestibular syndrome, which is what's making her head tilt. She has a lot of back pain, so she does move very stiffly.
Savannah also has cataracts, bladder control problems, allergies, arthritis, stomach aches, is hyperthyroid, and has a heart murmur.
She probably has more things than most dogs, but when you get to that age, things do just kind of start to mount. A year ago, her liver enzymes were very, very high. I mean, like 10 times normal. And so this year, her blood work is showing us that those liver enzymes are about 5 times normal. So not as high as they were before, but they're still pretty high.
Well, the doctor's thinking it could be because she's on so many different medications because of her multiple medical issues and her age and her supplements, that she might have hepatitis. It could be a liver infection, or it could be cancer.
Hello, how are you doing?
I'm good, Dr. Singer. How are you?
Good.
To get a better understanding of what is causing Savannah's liver enzymes to be so high, Dr. Sanger goes over the list of medications that Savannah is on in hopes that some of them can be eliminated.
Well, this is for her kidneys, heart. And this is to help keep her from losing her urine. So that's keeping her thyroid.
Mm-hmm. Well, she's lost so much weight, she's gone from 20 pounds to 15.7.
Yeah, and it worries me. And so today, part of what we're doing today is determine, is there another reason for her weight loss?
At Bees Ferry Veterinary Hospital, Dr. Sanger is about to perform an ultrasound on Savannah to see if she can find any signs of hepatitis, liver infection, or cancer.
All right, so got the probe on here. And abnormal textures is what I'm really looking at.
Getting hot? It's okay. It's hard to be on your back that long.
I know, especially with her sore back, so I'm trying to go fast here.
You're such a good girl. Yeah.
Okay, you got this, baby girl. I'm almost done. I got almost all my pictures of your kidneys here. And I'm gonna turn it on its side. Let's see if we can get her right kidney.
We're gonna roll you this way. There we go. Mommy's right here. Sweet girl. I know you don't like it. I know.
Her liver is an abnormal texture.
Back at Veterinary Specialty Care, Dr. Brofman and Dr. Bostian are scrubbing in before performing the craniotomy on Putter.
There's a number of complications that can occur with surgery. Worst case scenario would be that There is a lot of adhesions that it's involving more than just the layer of tissue that surrounds the brain, but it's actually invaded into the brain as well, which would make it much more difficult to remove. Anesthetic reactions, bleeding, there can be swelling within the brain that can potentially cause shifts within the normal brain tissue and can be potentially fatal as well. So that there's life-threatening complications that are possible here today. This is an unusual breed for this to happen. It's also in an unusual location. Usually it's along the spinal cord. Usually it's in what's called Rhodesian Ridgebacks as a breed. I'm only aware of one report of this in a dog on the top of the head. And in that case, it did not extend down into the skull. And based on the MRI, it looks like this one may extend into the skull and around the brain. And I'm just trying to be careful to minimize the amount of tissue that we have to dissect here to make it easier to close.
It's a new experience for Dr. Bostrom to see one of her own pets go into surgery, but she is confident that Dr. Brofman will give Putter a healthier life.
I can feel the orbit right here. So, I mean, we're talking, centimeter or two from the eye socket. And I mean, I'm not as concerned that I'm going to go into the eye socket or orbit, but more concerned that it's just going to be difficult to close the skin.
Dr. Ludwig, who specializes in soft tissue surgery, is called in for her opinion on the cosmetic appearance of Putter's extensive skin removal.
I'll just continue to dissect this out, and then I'll let you know and just get that little tidbit from you, see if we can close it or if we need to have you scrub in and do a flap. When I did my medicine residency in New York City, Dr. Ludwig was actually a surgeon there at the Animal Medical Center. Just by coincidence, I ended up here again this past July with her. I had no idea she was here. I can feel this right here, just right of midline. On the back of the skull is this kind of bump in the skull, and this is, actually I can feel what the normal structure is, and this is abnormal skull right here.
Dr. Brofman has noticed an abnormal structure on Putter's skull. Fortunately, it's not an issue to be concerned with.
There definitely was an area of abnormal bone on the top of his skull. It doesn't seem like it will cause any type of problems. There again, it's probably just a birth defect and just one of those things, but it shouldn't have any long-term effects.
So from what I'm seeing so far, I don't find an extension. I'm not completely done dissecting, but I don't find an extension of this into the skull. Sometimes the MRI can be misleading, and that's been reported in the past, and people have gone in expecting to do spinal surgery to remove this and find out once they get down there that it doesn't extend into the spine, and so sometimes it actually isn't brain surgery.
So it looks like this lesion is just going to be superficial. It's just going to be basically a skin cyst. So the fact that it's not going to go into the brain tissue is very exciting. It's something that I've been waiting months to find out.
This means Putter is going to have a nice little scar on the top of his head, but hopefully there should be no after effects at all, and he should just live a normal life.
It's always a relief to know that you don't have to do a brain surgery if it's not necessary. There's always, the excitement, and it keeps the day interesting to be able to do it, but if it's not necessary, I certainly don't want to do it, and I try to avoid it if I can.
Given that the fact that this skin mass has just been growing and growing and growing, probably would have eventually needed to be removed anyway, and probably easier to do it now when it was still smaller. The big complication we see with it when it's just in the skin is just recurrent abscesses and infections.
Which he's already had twice.
And then actually what we may do is repeat an MRI and just see what it was that we were seeing before and see if it was just what we call an artifact, which is something that appears on the image to be one thing, when in actuality there's other factors that may be influencing the image to cause a false image. And just double check one more time around here and make sure. Feels pretty good. We're gonna go ahead and wake him up now and just keep them comfortable, and you'll take them home today, I guess. And
Yeah, whatever you
yeah, I mean, if we're not, since we didn't do the brain part, I'm comfortable sending them home, and you can give like injectable pain medication at home if you want, or whatever you prefer.
Potter will spend a few hours at veterinary specialty care as he recovers from surgery. In a couple of weeks, Dr. Brothman will do a second MRI to double-check that there are no underlying issues consisting within his brain.
We didn't know how today would turn out, so it was a pleasant surprise in that we didn't actually have to go in and find anything in his brain. So his quality of life should be totally normal. He's going to be a happy and healthy puppy. There's definitely a bond there that I've had with him for the last several months, but to know that I can give this gift to my dad means more to me.
After seeing abnormal textures in Savannah's liver on the ultrasound, Dr. Sanger is now concerned that cancer may be present.
So what I'm going to do is I'm just going to take this very, very narrow gauge needle here, and I'm going to stick it down into her liver using the ultrasound to guide me into the spots I want to look at. And I'm going to get some cells into that needle, and then we'll blow those onto a slide, and we'll send those slides to a pathologist and have them tell us about the abnormal cells that are there. Are there abnormal cells there?
Take a little prick and we'll be all done.
That's a nice sample, right where we want to be. Got it?
There we go.
Okay. I'm gonna let you go. I'm gonna let you take her home. I'll put all this together, make a plan for you, and we'll go over it tomorrow. Okay? Good to see you. As long as we control her pain, that's the most important thing. And I don't want her to get nauseous and feel sick. Those are the bad things, nausea and pain. So that's why we stay on top of these things with Savannah, because we don't want her to feel bad.
I'm thinking it's the old age and medications that we have to keep her in pain medication, and we'll just do whatever we need to do. Savannah's our little girl, so we'll get whatever treatment she needs, mortgage a house again or whatever.
This is a dog that literally grew up with this hospital. And this hospital is only 18 years old. And I mean, that's a special thing when you can take a dog all the way from puppyhood through their very old age. And usually we take them through death as well. I'm gonna cry. I mean, so we've known these clients for a very, very long time, and they just become part of the family.
Before deciding how to treat Savannah, Dr. Sanger will have to wait until pathology results come back with the diagnosis. It's still uncertain if Savannah has hepatitis, a liver infection, or cancer. Two weeks have passed since Savannah had an ultrasound and blood work done. Thankfully, no cancer was present in the pathology reports, but it did suggest that the medications were causing the high liver enzymes. However, it is uncertain which drugs are causing the problem.
We were afraid she was going to die, we were going to lose her or something. We weren't ready for that because she's been our baby for almost 16 years. And we're just trying to get her off as much medication as possible so her liver can heal. We're just real thankful.
I stopped 5 of the medications that she was taking. Some of them were for allergies, one of them was for her arthritis, and we just tried to get all of her doses down to as low as possible. So today, 2 weeks later, we're going to check her liver enzymes and see if they are decreasing now that we've made those changes.
Hi, honey. How's my girl? Come say hello.
She's gained a pound.
Yes, in 2 weeks.
I'm so glad.
I know. We've been praying hard for her.
Hey, Savannah, have a cookie.
All right. Well, let's take you up on the table, and we're going to take a look at you, and then we'll put everything all together.
Savannah gained a pound since I last saw her, and that's in 2 weeks. And that's really good. Her liver function had just decreased to the point where she couldn't even keep weight on.
What about any evidence of more pain since we reduced some of her medicine?
I think she's doing pretty good.
Okay.
All right, let's listen. Oh, right on cue, huh?
Got a hairball?
Yeah. know, she just looks shinier to me. She looks bright-eyed, and she still has that head tilt, but she's just moving around better. She just feels better.
Blood work is done to conclude if Savannah's liver enzymes are better or worse after dropping 5 of the 16 medications that she's currently on. It will be 2 days until those results come back from the lab.
We will continue to monitor her liver enzymes on these lower dose of drugs, and if we can get her liver enzymes down into the normal range, she stays off most of these medications. I'll be able to spread out the times, you know, how far it is in between before I have to check blood again. But right now, I'm going to continue to monitor her like monthly until we get her where we want her to be.
Well, we're excited that she's getting better. We're very pleased with Dr. Sanger and all the staff here at Beast Ferry. We're just hoping that she'll continue to improve in health and live long and prosper.
It's been 2 weeks since Putter's surgery. His incision has healed and he's back to his old bouncy self. Today, Dr. Brofman will repeat the MRI to see if there is anything else to be concerned with.
I'm going to stay today to go in with Dr. Brofman to watch the MRI and to see if there's still something there or if it's truly an artifact in the brain. And hopefully that's the case, which means Putter will be a perfectly normal pup.
So how's Putter doing?
He's doing great. He didn't have any problems after surgery. Incision healed well.
Good.
I don't think the biggest part was keeping him quiet.
Yeah. Okay, good. Yeah, just a little lump there. You know, although we didn't find anything that looked like it extended to the brain, although it looked like on the MRI that there could be something there, we just want to make sure there's not something else we need to address.
For sure.
So here's where it was outside of the skin right here. I'm not seeing anything real obvious that, you know, it doesn't look like we're seeing what we saw last time. So certainly I'll send it to the radiologist to see what she thinks though. It's good.
So far, the images look perfectly normal, and what we saw a couple months ago is not there.
So I think that with those findings, he's pretty much in the clear, and I don't think that we'll see any problems in the future. We're not going to have to do anything where we risk damage to the brain, and so it's a very good thing for Putter.
We're going to send off these images today to the radiologist just to confirm that everything is fine, and then he should be going to his new home next weekend to my parents. I'm happy for him. To know that he will lead a perfectly normal life. It's not every day that I get to come over here and be involved in this. So to be here and to work with him and his staff, they're phenomenal. And I get to now go back to my clinic and pass that on. So when I send people over here, I have the utmost confidence that their animals, and as well as them, they're going to get taken care of.
Today on Rescue Vet, a white Labrador retriever has developed a mass in his neck. After an invasive surgery, will biopsy results reveal that it's cancer, or is it a treatable infection?
We love Gordon, and we want him to be healthy and live a long, happy life.
Dr. Berger makes a house call to one of his regular clients to investigate a goat's bloated abdomen. Will a fatal heart disease be mistaken for a pregnancy, or will the arrival of babies be imminent?
Parasites can fill up the intestinal tracts to look like she might be pregnant. Parasites cause anemia, and anemia causes death.
Anthony Sitton has driven 2 hours from Florence, South Carolina to veterinary specialty care with his 5-year-old white Labrador retriever, Gordon, who has developed a lump on his neck. Since antibiotics have been unable to treat it, at this point the diagnosis is unknown.
He's developed a mass in his throat, and we've taken him to the vet that we have at home in Florence, and they've done a couple needle biopsies and weren't really able to determine what it was. The clinic here in Mount Pleasant was recommended by our vet in Florence.
Gordon's had swelling, the owner's noticed on the neck. It's been going on for a long time. It changes in size. Initially, they thought maybe it was an abscess. He has a history of being bitten by a snake in that area, but it's not been responding to antibiotics. So now they're worried that it's either some deep infection, there's maybe a foreign object there, or unfortunately that it could be cancerous.
We love Gordon, and we want him to be healthy and live a long, happy life.
Gordon's blood is drawn to make sure it is safe for him to go under anesthesia. Anesthesia will be administered so that he is fully anesthetized before Dr. Ludwig begins surgery.
So we're just getting him under anesthesia, and then we're going to roll him up so I can see where this is and get her a better idea of how to prepare the surgery site. He's a big boy. Okay. So yeah, this is the mass right here. Doesn't look all that big, but they did say that today it's a little bit smaller than it has been. All right, I think that's gonna do it.
Sarah Dillo, a regular client of Dr. Berger's, has adopted 3 Nigerian dwarf goats within the last year. One of her female goats' abdomens appears to be increasing and decreasing in size.
Up until the past few weeks, I've noticed her gaining some weight. I'm assuming she may be pregnant. I'm not sure. Her weight's been fluctuating. So we contacted Dr. Berger to come out and just take a look at her, see if she is in fact pregnant. We just want to make sure that it's not something that could be dangerous for her and that it's something we can treat if it is.
Dr. Berger will examine Sarah's goat Shai to see if she is expecting. However, there is a chance that parasites or even a fatal heart disease could be mistaken for pregnancy.
She was showing a nice, really well-defined tummy, and I'm not sure if it's getting smaller. I can't really tell. It looks to appear to be getting smaller. She's kind of gaining and losing weight.
Anytime the abdomen's swollen, we're looking for 3 things, basically. We're looking for pregnancy, which is what we hope for. 2, we're looking for an accumulation of fluid from the heart not being able to pump and keep up with the oxygen demands. And the 3rd thing is parasites, because the parasites can fill up the intestinal tracts to look like she might be pregnant. Parasites cause anemia, and anemia causes death. We always want to check their heart because one thing that happens with goats, just like people, is some of them are prone to cardiomyopathy, which is a genetic disease of the heart.
Right.
So you can actually mistake fluid in the abdomen for baby in the abdomen.
I see.
Unfortunately, cardiomyopathy in goats is not a really treatable thing. What happens is the heart dilates because it thinks it needs to get bigger to pump more, but it's actually getting bigger and getting weaker.
Dr. Berger is listening to Shai's heart for signs of a heart disease that can be mistaken for pregnancy.
I'm listening to her heart just to make sure that she doesn't have any murmurs or arrhythmias, signs that she could have something going on inside. We'll also listen to her chest to take advantage of listening and making sure there's no signs of pneumonia or any kind of fluid buildup in her lungs that could be secondary to a heart issue. So you can actually mistake fluid in the abdomen for baby in the abdomen, but her heart sounds absolutely perfect. So let's see if she'll let us take a feel of her abdomen without being too upset with us.
Thankfully, no signs of heart disease are present. Dr. Berger will now examine the abdomen to see if Shai appears to have parasites or is in fact pregnant.
By feeling around her abdomen, trying to isolate the uterus, we may be able to get a sense of if she is pregnant, how far along she's pregnant, and how many babies she might have. And right here where my right hand is, I feel the horn of the uterus, and I feel a head. So it's about the size of a ping pong ball, maybe a little bigger. So basically right here.
So
right
she's
where you're
pregnant.
thinking. So that is a baby there.
Yay. So she is pregnant. It wasn't anything wrong. There was no bloat or issues like that. It seems like a normal pregnancy, so we're really happy.
And on the left side,
Here, mommy.
I think I feel a baby that's upside down and backwards. That's not a problem right now. So there's two in there.
Oh,
twins.
wow. Awesome. Dr. Berger being able to feel the babies in there, and he could tell how they're, how they're laying. And the moment he said there was two in there, it was like, oh my God, you only expect one to be in there. So we do have two babies. It looks like we're gonna have twins.
It's always fun to see people's reaction when they know they're gonna have twin babies. It's interesting to see Sarah because I think this is her first time that she's gonna witness the birthing of the goat. So it's always pleasing to see how happy she can be.
Now, should I separate her from everybody before she has the baby?
I would.
Okay.
Yeah. I mean, obviously he's still somewhat interested in her.
Right. He did recommend that a couple weeks before she's due, we separate her because they can become aggressive towards the end of the pregnancy, and we just don't want any harm done to the babies.
In addition to keeping the father away from Shai during the last few weeks of her pregnancy, Sarah will have to monitor her to make sure there are no other complications before or during birth.
If she were to have a miscarriage, we would contact immediately, and in that case, it would be an emergency that we'd get her seen.
The really big thing is, straining to have a baby and nothing coming out. So if that happens, more towards the time or up to 2 weeks early, that's an emergency situation.
Okay.
We'd have to come out and either do a C-section on her or help you pull the babies out.
She could, go into labor, and we would need assistance on getting the babies out. So I'd have to call Dr. Berger and make sure that everything was okay. I'd be terrified if we lost the babies, but first and foremost, I want to make sure that she's okay. Oh, I'm so excited.
Gonna have twins, I can't believe it. I had no idea.
We're gonna cross our fingers, hope everything goes as planned and that the babies are healthy and that they're born healthy.
They say goat gestation is 3 months,
right.
3 weeks, 3 days at 3 in the morning.
Right.
I don't know why, but they always have their babies in the middle of the night.
That's what I hear.
The babies feel like they're about this long today. So at the time of birth, the babies are about 1.5 inches longer. So my estimation is they have about another month to go.
I'll be calling Dr. Berger as soon as babies are born. I want him out here to see them, to check them, make sure everything's okay, and we can't wait. We're so excited.
At Veterinary Specialty Care, Dr. Ludwig is beginning surgery to determine if the mass on Gordon's neck is a foreign object, an infection, or a cancerous tumor.
So I'm just going to make an incision kind of right down the middle of the neck. We're going to go down to where we can see the trachea, and then we're going to figure out what this mass is attached to. We'll look at the esophagus and the thyroid glands and the parathyroid glands and all the vessels in this area.
Dr. Ludwig will remove the mass and examine the surrounding areas to see if there are other signs of infection or cancerous tumors.
I'm still unsure as to what it is or what it's attached to. It's definitely more to the left side of the trachea. And I've seen everything kind of on the right side, the glands and the trachea nerves on that side, they all look fine. I haven't seen the thyroid gland on this side. I haven't seen the esophagus yet, so we're still just kind of working around, carefully getting our way down there. The tissue already looks abnormal. It's thicker than we would normally see. It is pretty big, and it does look like it's at least on top of the trachea in addition to maybe being on both sides.
Not only is the tissue thicker than normal, but the size of the mass in Gordon's neck is also cause for concern.
What seems like that mass is out. Once I get everything closed up, I'll go ahead and section into it, see a little bit better what it looks like. And now I'm just kind of going back through, just palpating, making sure that I haven't missed anything. So I can see the right thyroid gland, parathyroid glands, the right side of the larynx or the voice box, the right side of the trachea, and that all looks pretty normal. So I do think most of our issue is now going to be on this left side. It's an area that is a little bit nerve-wracking to work in because you have the trachea, the esophagus, some important nerves and blood vessels.
No foreign objects have been found in Gordon's neck. However, at this point, Dr. Ludwig is still unsure if the mass is an infection or a cancerous tumor. She is hopeful that by removing the mass, nothing will spread to the rest of Gordon's body.
Gordon seems like the kind of dog who's going to wake up and act like nothing ever happened.
Exactly.
It's been an hour since Gordon's surgery, and he is already awake and alert.
After we got everything closed, I went back and kind of cut into the stuff that I took out, and it was like a cystic thing filled with brown fluid. I'm turning some of that fluid into the lab for culture because obviously the antibiotics he's been on haven't been working. So to see, you know, what it will be sensitive to, and then we're still going to submit it for biopsy just to know everything, because sometimes there can be fungal infections, you know, that aren't going to be something you'll pick up on a culture. At this point, I'm hoping it's not cancer.
After just a few hours of recovery, Gordon may be able to go home later today. It's been 2 months since Dr. Berger's visit with Sarah's goat, Shai, and the babies have finally arrived. However, it is uncertain that they both are 100% healthy.
Hello.
Hey, Dr. Berger, how are you?
I heard you have some babies.
I do. She had her 2 babies about 2 nights ago.
Oh, great. Any issues?
No, none.
Were you able to witness it? Or?
I wasn't. She had him in the middle of the night.
They'll hide it from you.
Yep. It was actually in the middle of the night, about 4 a.m. I was sleeping. I wished I had set an alarm clock, and I missed it.
Oh, so cute. Are they boys or girls? Have you checked?
I haven't checked.
Hi, Mama. You're protective, huh? Hi, little one.
Mama has been nursing them, letting them nurse?
Yes.
And past the afterbirth okay?
Yes.
Okay, good.
It's quite a mess.
Quite a mess, yes.
I feel very lucky that something didn't go wrong. I have heard from many people about babies being breached, and if you're not out there to help the mom, that it can be deadly for all of them, the babies and the mother.
Although the babies appear to be in good health, Dr. Berger will still need to do a full examination.
Oh, it's okay, little one. You got a leaf in your mouth? Mm-hmm. This is a little girl.
Yay!
Let's take a look in your mouth. So now I'm just checking her soft palate to make sure it's good and her teeth are coming in very well. It's just the first checkup, first of many.
Okay,
Right now, I'm just checking for any arrhythmias, any heart murmurs, any signs of infection in the chest.
Okay.
Other than a little bit of nervousness, the heart and lungs sound healthy.
I'm just checking her joints. And umbilical cord looks good. Let's take a look at this one. This one is also a girl. 2 girls. No boys.
That's exciting.
It's all right. It's okay. Let's take a quick look. Good. Perfect. So that sounds perfect. No murmurs, no arrhythmias.
Because of the possibility of parasites being transmitted from mother to babies during pregnancy, Dr. Berger will give the goat babies a dewormer for safe measure.
So this is a wormer that gets all the parasites that they could possibly have.
Okay.
So I want to do this now, and then we'll do it again in 4 weeks.
Sounds good.
And they're pretty good for it. Say ah. Oh, what a good baby. Okay, little baby. Your turn. Good baby. Okay, that's good.
So cute.
That's my first banana-flavored dewormer ever.
After a full examination, both the goat babies are signed off on a clean bill of health.
Here you go, Mama, here you go. So 2 really healthy babies.
Awesome.
That's really nice.
Exciting. I absolutely adore them. They are the cutest thing in the whole world. I'm just happy that they were healthy, and when I walked out there and saw them jumping around, and I was just overjoyed. It's amazing to see something this beautiful born, you know? I mean, it was a miracle.
In 6 weeks, Dr. Berger will return for a checkup to monitor their growth and development and start the babies on their vaccines to prevent them from getting viruses and diseases.
So everybody looks great. You got this healthy-looking baby who's definitely a little feisty. Wants his mama, wants her mama. Mama looks good. She's letting the babies nurse. The babies are nursing well. They don't appear to have any kind of congenital defects. She's kept the environment very clean, provided hay, clean water, shelter. So she's done a great job.
It's just amazing that this is a little living creature, and it's adorable. It's fantastic. I wish everybody could experience this.
Little baby goats make me want to have a yard full of them, but unfortunately that's not possible. Little baby goats want their mamas too. There you go. All right. Didn't hurt the baby, okay? All right.
After a remarkably fast recovery from surgery, Dr. Ludwig has decided to send Gordon home with his owners.
So I'm going to talk to the owners about how the surgery went, what I found, and we're basically going to have to wait for the results of the biopsy and the culture, but right now I'm hopeful that it's going to be something infectious, inflammatory, not necessarily cancer, but we're going to have to wait about a week to find those results. Okay, you ready? Oh, okay.
Hey, Koda.
Hey, Koda.
There he is.
Oh, Kevin. It's okay. It's okay.
Koda. Hey, buddy.
So the incision is all right down here.
Okay.
You can kind of look under and you see right there, you see one of the staples. So I really would like to keep it covered, and that's, you know, it'll protect the incision from him scratching at it, but also just because I don't want it to get swollen. So I'd like that to stay on until the staples come out, which is about 2 weeks. The mass itself was basically about the size of an egg. It was thick, really thick white tissue. After I had everything done, I went back and, you know, cut into the mass, and it was filled with brown fluid. So I think that, to me, makes it more likely to be an infectious thing than a cancerous thing.
Well, that's good. That's
but obviously we have it turned in for biopsies and cultures, and so within about a week we should have some answers as to what it is.
Great.
Well, thank you so much.
All right, you're welcome. And obviously give us a call, you know, if you have any troubles when you get him home, because there's always somebody here, so. But I think the only trouble we're gonna have is keeping him quiet.
That's right. Yeah, and that's his thing anyway.
He's the whiner.
Yeah.
I think the surgery went well. He recovered very quickly, and so it was great to be able to get him home the same day. And so now it's just a matter of waiting for the biopsy results and the culture results.
All right, calm down. Come on, let's go over here. I'm hoping that it's just an infection. It would be very saddening to find that it was some type of cancerous material that is going to require further care and maybe affect Gordon's quality of life. There he goes. He's home.
There was no cancer, it was all infection. We did have to call in a different special antibiotic for this type of infection. And I think the combination of getting the whole thing out, exposing it to the air, and the antibiotic is going to be a cure for him. It was great to be able to have a patient who the owners really love and wanted the best outcome, and to have it turn out to be the best for him, that he's going to be cured of his problem and live a long, healthy life.
Today on Rescue Vet, a French bulldog diagnosed with a brain tumor is admitted to the emergency room after a series of seizures. Is the tumor treatable with chemotherapy, or will the owner be faced with euthanizing her companion?
My concern is that it's starting to come back now and that we're starting to lose the battle.
A cat with a foot infection is taken to Bees Ferry, but after further examination, will it result in an amputation?
The infection can get into the bloodstream and create sepsis, and animals can die.
Dr. Natalie Wendling, a local veterinarian, has taken her 4-year-old French bulldog, Butters, to the emergency room at Veterinary Specialty Care after being diagnosed with a brain tumor called glioma several months ago. Butters has been battling a series of seizures. Recently, they have become uncontrollable.
Butters is a patient I've been working with now for a few months, and presented to me initially for seizures and some weakness. We did an MRI. Even though he was such a young dog, he's only 4 years of age, it did look like there was a tumor in his brain. So we sent him down to the University of Georgia Veterinary School, where they were doing a special trial, drug study, and they did surgery to remove as much of the tumor as possible, and then inserted tubes to directly inject chemotherapy into the tumor. And what we've been doing over the last few months is follow up serial MRIs to see how the tumor is progressing and how it responded to the chemotherapy.
The foundation that's funding all of this is called Boo Radley Foundation. And Ken Johnson is the founder of it, and his dog actually had a brain tumor. And so he's very adamant about wanting to find a cure for this. And not only is this helping dogs, but they want to try the same drug that they use on Butters in humans.
With the support of the Boo Radley Foundation, the University of Georgia, and Emory University, Butters' initial prognosis of 1 to 2 months has extended to 3 months.
Initially, after the surgery he had down at University of Georgia, things were going very well. His seizures were well controlled. He was returning back to his old self. But recently, over the last week or two, he's been having more and more seizures and becoming less personable. Our concern is that although previous MRIs had shown very good tumor control with the chemotherapy, my concern is that it's starting to come back now and that we're starting to lose the battle.
Right now, he's been sedated before his anesthesia, and we are going to be doing an MRI, a follow-up MRI today, to see if there's any tumor regrowth to explain the seizures that he's having again, or if it's just a continuation of his prior seizure disorder associated with the tumor that was removed. So we'll know a lot more later today.
Chris Hackett has brought his 4-year-old cat Joey to Bees Ferry Veterinary Hospital for a foot infection caused by a deeply ingrown nail. Joey was declawed as a kitten. However, years later, one of his nails has grown back, creating pain around his paw.
My wife noticed that he's been bothering, and we took a look at it and noticed that he was in a lot of pain when we touched it, so we decided we better bring him into the vet here real quick.
When you do a declaw, you're removing the first digit of every finger. They have the digits on each bone just like we have. So you're creating an amputation right here. And sometimes some bone can get left behind, and that signals the body to regrow. And as a result of the nail coming through the skin, it creates an infection and an inflammatory process around there, and it's quite painful.
But obviously, the first procedure, they didn't get it, and it's been growing back over the years.
The infection can grow and grow and grow, and it can get into the bone. And if we get infection in the bone, that can be very serious. So we may have to amputate higher up if the bone is infected. The infection can get into the bloodstream and create sepsis, and animals can die. So what we're going to do today is cut the nail and get that out of the paw pad, so get rid of the offending agent. This can't feel very good. So what I'm going to do is I'm just going to cut this nail in half and get that out of there. Probably be a nice relief for him. So 1, 2. Hello. Okay. It's always that initial click that I always get. Ooh. I know it. Okay, let's see.
Let me regrip him.
Here's one part. Oh. So it's really grown in there.
It's all right, Joey. I know,
Joey. Little Joey. It's okay, my friend. Hold on. All right, let's see what we can do about this.
Dr. Mayers is trying to safely remove Joey's ingrown nail, but without the use of anesthesia to control the pain, she is limited to what she can remove.
Oh, I know, my friend. Seeing any animal struggle really hurts you, and I think that's why I stopped abruptly once I saw him struggling, because we're in this profession to heal and to prevent pain, and once I noticed that we're in pain, that obviously doesn't sit well in your belly as a veterinarian. So luckily, we can give a lot of things, but to investigate that deeper, anesthesia is going to be warranted. I think this is the best we're going to be able to do. I'm going to shave all the hair around here and really scrub this up, but I think that's the shortest, but you can see all the skin has ruptured. It's a real mess. He's shaking because he's really nervous. He's got pain medicine on board already. Let's get all this hair away from here. Oh, it's sensitive, and you can see his paw's pretty swollen too. We're just getting the hair away so we can have a cleaner working surface. Oh, I know, my friend. Hey, let's see how that looks, my friend. Let's see. Whoa, so let's scrub that up. You can see how swollen it is from here to here. We're gonna have to go in there surgically and clean this bone out anyway.
Joey's nail is so deeply ingrown that surgery will be necessary to fully remove the nail. To get him through the next few weeks before his surgery, Joey will be put on antibiotics, anti-inflammatories, and pain medication.
He ate this morning, so you really want to prevent general anesthesia when they ate, but this isn't a surgical emergency. So to stop everything that I'm doing to go right into surgery to heal this foot, that can be scheduled during a surgical day when we're prepared for this.
Back at Veterinary Specialty Care, Dr. Brofman is performing an MRI on Butters. After days of intractable seizures, it's possible Butters' tumor has come back, and it may be larger than before.
So you can see this right here.
That wasn't present. That's where the tumor was originally, and that was not present on the scan in December. Yeah, and so it's extending a little bit further back. When Natalie came in to look at Butter's MRI, I was showing her how the tumor had recurred, comparing the previous MRIs post-operatively to the MRI today, and there's obvious recurrence, unfortunately, and it even looks more invasive and more involved than prior to surgery. It's definitely back worse than before. This just wasn't here before last time. So, all right, I'm sorry.
I know that looking at that MRI, he doesn't have long, and I kind of knew that before. I thought I'd have longer than 4 months, but without a lot of this, I wouldn't have had that long. So, and we've gotten some good family time with him.
Surgical technician Lori Brothanek monitors Butters while he comes out of anesthesia. Because Butters is prone to seizures, it is essential a watchful eye is kept on him.
We're just waking him up. He's on oxygen right now. I'm monitoring his heart rate and his SpO2 level, and I'm just gonna wait for him to wake up. The brain tumor's gotten bigger, which is not very good news, so we'll see what the owner wants to do. She may be putting up a step.
Anesthesia can be risky, even for healthy dogs. So Lori will stay with Butters until he wakes up, while monitoring his heart rate, blood pressure, and breathing.
What happened?
Butters had a post-anesthetic complication in our recovery unit where he stopped breathing and his heart stopped. And my suspicion is that it probably occurred secondary to a lot of pressure on his brain from the tumor that can cause compression and affect the parts of the brain that are responsible for controlling your heart rate and your breathing.
Get 12 grams of mannitol.
Lori, the technician who was recovering him, noticed that the breathing had changed, and unfortunately she noticed that immediately and was able to, sound the alarm.
He had a good eye reflex, and when I went to go touch it again, he didn't have anything, and he just stopped breathing. I mean, it literally happened in a second.
Finally, a heartbeat is detected, but Butters isn't out of the woods just yet.
So right now what we're doing is trying to give medications to decrease the pressure that may be built up in his brain from all the swelling. And I mean, he's got a good blink reflex and he's doing okay right now. It's possible that this is seizure activity, but I think it's almost more like it's shivering. He feels warm. Do we have a temperature on him?
Yeah, I just got it. It was like 95.
Okay.
Kind of getting sensation back.
Yeah, I mean, he's got a good blink reflex. Just means he's responding somewhat. So yeah, he's just shivering from a low body temperature.
Good job, Lori. Good being on top of that.
After everyone's nerves have calmed, Dr. Brofman administers a drug called mannitol to decrease the swelling in Butters' brain.
This is certainly not something that's good, and it makes me concerned.
His heart rate started to go up.
His heart rate started to go up?
Yeah, so
right
I
before
thought maybe he was, close to getting, awake.
The other possibility is that he may have had a seizure, and sometimes they can stop breathing during the seizure. The heart rate can go up, it can even go down. At times it usually goes up. So now he's starting to breathe on his own now, so that's a good sign. You can see the bag moving.
Thank you, Liz.
And so this is just measuring his oxygen levels. in his blood. So pulse ox, this is the percent that his oxygen is saturating his blood. So 100%, obviously he can't get more than that, so that's good. And then the 120 is his heart rate.
Butters is now stable, but he is still at high risk for seizing again. Without the use of anesthesia, Joey will not be having surgery today. To help fight the infection and diminish his pain, veterinary technicians administer a series of shots to get him through the next 3 weeks before his surgery.
We got an anti-inflammatory drug on and an opiate for pain. And plus we needed to give antibiotics and get the secondary bacterial infection eradicated before we go in there. So we needed some time before.
If the infection spreads, Joey may have to come back sooner, and it could mean his toe will need to be amputated. But hopefully, the antibiotics will help cure the infection. Three weeks have passed since Joey's initial procedure at Bees Ferry. Today, he is scheduled to have surgery to fully remove the ingrown nail in his paw.
We gave an estimate to the owner of what surgical removal would cost, and he went to the previous veterinarian who did the surgery, and that veterinarian offered to do it for free to correct what he did wrong. I'm really glad that he sought attention for this. Obviously, this was a painful process, and no matter where he goes, obviously I would love for him to come to me, but as long as he's getting attention, that's all I really care about. So I'm glad he's doing better, and I look forward to seeing him soon.
After a near-death experience, Butters is slowly waking up from anesthesia and is beginning to breathe on his own again.
So his temps getting back into normal, and so that's good because his brain is like, it obviously regulates all that, so it's coming up. So maybe he's gonna wake up for us.
You want to leave him here another 24 hours? You want to take him home and see how he does? You can always bring him back if you need to.
Yeah, I might come back this afternoon and get him.
Okay, yeah. We'll see how he is when you're off work.
Yeah, if he's gonna start seizing again, it's just gonna make me cry.
Yeah.
And I won't be able to.
Yeah.
Hey,
but yeah, I mean, that's
what are you doing?
The brightest I've seen him looks in the last few days, so. Yeah, he looks pretty good. I mean, relative,
I mean, considering what his MRI looks like.
Maybe it's the mannitol and everything that we just gave him. It just kind of helped reduce some of that edema, and so it's brightening him up. After the anesthetic crisis that he went through, we gave him some medication to help decrease the swelling on his brain. And as he recovered from that, he was actually starting to look a lot brighter, and a lot brighter than really I've seen him in the last couple of weeks. So I'm optimistic that we might get some more time with him, and it might help us get the seizures under better control and get him home. We'll keep him overnight and hopefully get him home tomorrow.
What do you think? Huh? So he's more alert. His temperature's getting back to normal. We're unhooking him from all the monitors, and we're just going to wait and see if he continues to become more alert. So, I mean, there's always a potential that he doesn't because he's been through so much.
Although Butters is showing signs of improvement, his seizures could reoccur at any moment. Because of the swelling in his brain, it is uncertain how much time he has left.
He seems a little more out of it.
Yeah, he is. Unless he's just tired. Being on the other end of it has made me a better veterinarian. I know now what my clients go through, and it is tough. And not that I was, cold-hearted before. I just didn't know to the extent I was supposed to have more time with him, and so I get it now. And so it's been I've realized a lot, him going through this with him. So there's been some good to come out of it.
So yeah, I would say let's, we'll keep him here for the afternoon. Okay. You can go back to work. Just whenever you get off work, just come on down.
All right.
All right.
Well, thank you. We'll see what happens.
Yeah.
We're gonna leave him here until the end of the day, and then if he's not had any more seizures, then I'm gonna take him home tonight and see how he does overnight.
Dr. Wendling knows her time may be short with Butters, but she is grateful for the time that she has been given with the help of the Boo Radley Foundation and Dr. Brofman.
It's been an amazing journey with Boo Radley, because honestly, financially, I wouldn't be able to do all this for him. And he wouldn't be here today, as grim as this looks today, he wouldn't have made it this long without people like Dr. Brofman and Dr. Platt and Georgia and Boo Radley. And hopefully Butters is gonna help them figure out something to help save some people one day, you know? That's the goal. Hi. He's a good boy. He's a sweet boy. Ready? Come on, let's go find your room. Maybe they'll give you a room service this time, huh? When you're a little more awake.
Right now, I think that his biggest challenge is overcoming these intractable seizures. And if we can't get the seizures under control, his quality of life is not going to be adequate, and she may have to make a tough decision. Last night, Natalie took Butters home, and she did call me a few times at home about his condition and saying that he was having a number of seizures. And so she elected to bring him back in and keep him here overnight to be treated by the emergency clinic and try to get the seizures under control. This morning, she elected to have Butters put to sleep. It's always upsetting for us as veterinarians and also for the owners to have to make that decision. If they're not enjoying running, sleeping, eating, being loved, then sometimes I really think it can be the biggest act of love they can choose for their pets.